guys, today we're going to talk about duloxetine, which is also known as Cymbalta. We're going to talk about the classifications, indications, which are the uses, side effects, adverse effects, the nursing implications for it, some patient teaching, nursing diagnosis, mechanism of action, and even some off-label uses. Starting with the classification, the pharmacological class is an SNRI, which is that serotonin neuroepinephrine reuptake inhibitor. And then the therapeutic class is antidepressant, anti-anxiety, and anti-pain. Mechanism of action, we know that duloxetine works by inhibiting the reuptake of serotonin and norepinephrine in the brain and spinal cord. This increases the levels of neurotransmitters in the synaptic cleft, thereby improving mood, anxiety, symptoms, and pain perception. And we also know that serotonin is our mood, appetite, sleep, pain, and GI function, as well as norepinephrine is our mood, attention, arousal, and pain. Okay, now we have our indications, which is why we would use this drug, which would be major depressive disorder, generalized anxiety disorder, chronic pain, stress incontinence. This goes with an off-label use, which would be PTSD, which is post-traumatic stress disorder, social anxiety, menopause, and chronic tension headaches. Alright, so we have our side effects, serious side effects, and adverse effects. So some of our side effects include nausea, dry mouth, drowsiness, fatigue, insomnia, constipation, sweating, and dizziness. Some of the more serious ones include hypertension, this being due to increased blood pressure, especially at higher doses, as well as liver damage. And then we also have adverse effects, which include serotonin syndrome, which would just present with high fever, seizures, irregular heartbeats, as well as withdrawal. If you abruptly just stop taking the med, it can lead to all of these symptoms over here. A lot of drugs we know risk for glaucoma, may increase intraocular pressure, as well as risk for bleeding when taken with anticoagulants or antiplatelet drugs. Okay guys, we are almost through this. We have our nursing diagnosis, which I put for risk for suicide, related to the potential increased suicidal thoughts and behaviors when initiating or adjusting doses of duloxetine. I gave a little bit of a rationale, which would be like many antidepressants, they carry a black box warning for increased suicidal thoughts and behaviors, particularly in children, adolescents, and young adults, continuous assessments of mood, behavior, and any self-harm ideation if necessary. As well as our nursing implications, we have assess mental status, regularly monitoring the patient for signs of the suicidal thoughts, and also monitor for side effects. We have weight loss and appetite changes, blood pressure, liver function, and electrolytes, as well as we mentioned earlier, that sexual dysfunction. We can also provide our patients with education, educate patients about the importance of tapering off doses of duloxetine under healthcare supervision to avoid withdrawal symptoms, like we talked about earlier. That could be a serious adverse effect. We also have caution with older adults, more likely to experience side effects such as dizziness, falls, so just be careful to monitor with them taking it. Okay, and then last but not least, we have patient teaching, which is so important when starting a med, especially a med like duloxetine. We just want to make sure that our patients know about the medication adherence, just instruct the patient to take the medication exactly as prescribed, even if they feel well, because oftentimes patients that feel well will just stop taking the med because they're feeling better, but obviously the med is making them feel better. Abrupt discontinuation can cause our withdrawal symptoms, so also teach them about gradual dose changes. Emphasize the importance of these dose changes, decreasing doses to prevent withdrawal, as well as our drug interactions, which is almost an important thing with every drug. Caution patients against using other SSRIs, as well as alcohol. Advise against drinking alcohol while taking this, as it can increase liver damage, like we talked about earlier. One of the severe cases of side effects was liver damage, but it's always important to teach your patient about the risks, as well as suicidal thoughts. Thank you guys so much for sticking around and watching this video. I hope you guys enjoyed learning about the drug just as much as I did.